Addiction, it's not just about drugs or alcohol anymore. In today's world, it comes in many forms. Substances, screens, sex, games, even the likes on your social media feed. But what really is addiction? Why do some people get hooked? And why is it so hard to stop? Whether it's the constant need to scroll, the urge to escape into a fantasy, or the daily battle with a harmful habit, addiction rewires the brain in ways most people don't even realize. It hijacks pleasure, kills motivation, and leaves millions struggling in silence. In this video, we're breaking down what addiction really means, from the science behind it to the behaviors we often ignore. Whether it's drugs, porn, gaming, or anything else, we're diving into the truth, the signs, and what you need to know. Because addiction isn't just about what you're using, it's about what you're losing. Addiction is a complex, chronic, and relapsing disorder of the brain and behavior that significantly impairs a person's ability to function normally in daily life. It is marked by the compulsive engagement in rewarding stimuli, whether they are substances or behaviors, despite the presence of adverse consequences. This condition is not simply a matter of poor decision-making or lack of willpower. Rather, it is a deeply rooted medical disorder that alters the structure and function of the brain. The affected individual continues to seek and use the substance or engage in the behavior, even when doing so results in health issues, strained relationships, legal troubles, or the degradation of personal and professional responsibilities. At its core, addiction involves a disruption in the brain's reward circuitry. Substances such as alcohol, opioids, nicotine, or even activities such as gambling and excessive internet use, trigger the release of dopamine, a neurotransmitter associated with pleasure, motivation, and learning. Over time, repeated exposure to these stimuli causes neuroadaptive changes in the brain, leading to a decreased ability to derive pleasure from everyday activities and an increased compulsion to seek the substance or behavior that initially caused the pleasure. These changes can persist long after the substance is removed from the body, which is why addiction is now recognized as a chronic brain disorder with both physical and psychological components. It is important to emphasize that addiction is not confined solely to the use of illicit drugs or alcohol. The modern understanding of addiction includes a range of compulsive behaviors, such as pathological gambling, internet gaming disorder, and even certain eating behaviors. The common thread among all these forms of addiction is the loss of control, the presence of cravings, and the continued engagement in the activity despite significant harm. For example, a person addicted to gambling may continue to wager large sums of money even after suffering severe financial losses and family disruption. Similarly, someone addicted to prescription medications may continue using the drugs beyond medical need, risking organ damage, overdose, or death. In clinical practice, we often assess addiction through a series of diagnostic criteria established in medical literature, particularly the DSM-5 Diagnostic and Statistical Manual of Mental Disorders, 5th edition. This framework outlines a spectrum of behaviors, including the inability to stop using the substance or engaging in the behavior, spending a great deal of time obtaining, using, or recovering from its effects, giving up important social, occupational, or recreational activities, and continued use, despite persistent physical or psychological problems caused by it. The severity of addiction is measured based on how many of these criteria are met: mild, moderate, or severe. One of the distinguishing features of addiction is the concept of tolerance and withdrawal. Tolerance refers to the need for increasing amounts of the substance or behavior to achieve the same effect, while withdrawal involves physical or emotional symptoms that occur when the substance or behavior is reduced or stopped. These physiological responses further cement the cycle of addiction, making it extremely difficult for individuals to cease use without medical or psychological intervention. It is also critical to distinguish between physical dependence and addiction. While the two often coexist, they are not synonymous. Physical dependence can occur with many medications, including those taken as prescribed, such as opioids for pain management. This state involves the body's adaptation to a substance, leading to withdrawal symptoms upon discontinuation. Addiction, on the other hand, includes behavioral components, such as craving, loss of control, and compulsive use, that go beyond mere physiological dependence. Thus, someone can be physically dependent on a substance without being addicted, and vice versa. Understanding addiction as a disease rather than a moral failing is essential for effective treatment and reduction of stigma. For decades, societal perceptions framed addiction as a lack of discipline or a character flaw. However, contemporary neuroscience and behavioral research have illuminated the biological underpinnings of addictive behavior, validating it as a legitimate medical condition. Brain imaging studies show alterations in areas responsible for judgment, decision making, learning, memory, and behavior control in individuals suffering from addiction. These changes are not easily reversible and often require long-term treatment approaches to manage successfully. The chronic nature of addiction also implies that relapse is a common aspect of the disease, not a sign of failure. Just as individuals with hypertension or diabetes may experience fluctuations in their condition and require adjustments in treatment, individuals with addiction may relapse and need continued support and intervention. This understanding encourages a compassionate, evidence-based approach to care, emphasizing relapse prevention strategies, patient education, and ongoing monitoring. From a public health perspective, addiction carries significant implications. It is associated with increased rates of infectious diseases such as HIV and hepatitis C due to needle sharing, increased risk of accidents and injuries, loss of productivity, family breakdown, and higher rates of incarceration. The financial burden on healthcare systems and society at large is substantial. Effective management and prevention strategies can reduce these burdens and improve individual and societal outcomes. In conclusion, addiction is a multifaceted and deeply rooted brain disease characterized by compulsive substance use or engagement in behaviors despite known harm. It affects the brain's reward system, alters emotional regulation, and significantly impairs cognitive functions related to judgment and decision making. The condition can be caused or exacerbated by a combination of genetic, environmental, and psychological factors. As medical professionals, it is our responsibility to approach addiction with empathy, evidence-based treatment protocols, and a commitment to reducing stigma through education and compassionate care. Recognizing addiction as a medical disorder, not a weakness, forms the foundation for effective intervention and long-term recovery. Addiction is no longer viewed through the narrow lens of substance use alone. Over the last few decades, our understanding has expanded significantly to include a wide range of compulsive behaviors that mirror the characteristics of substance dependency. Clinically, addiction is classified broadly into two major categories: substance addictions and behavioral addictions. Both share similar neurobiological pathways, symptomatology, and progression, though they may differ in external manifestations and social acceptance. Understanding the different types of addiction is critical for early identification, accurate diagnosis, and tailored treatment planning. Substance addiction refers to the compulsive use of psychoactive substances that directly alter brain chemistry and function. This category includes alcohol, opioids, benzodiazepines, stimulants such as cocaine and methamphetamine, cannabis, hallucinogens, and nicotine. Each of these substances acts upon specific neurotransmitter systems, predominantly the dopaminergic reward circuit, leading to reinforcement of the behavior and repeated use. For example, opioids activate mu-opioid receptors, producing analgesia and euphoria, which leads to repeated use and eventually dependency. Chronic use results in tolerance, wherein higher doses are needed to achieve the same effect, and withdrawal, a set of physical and psychological symptoms that occur when the substance is discontinued. Alcohol addiction is one of the most widely studied and prevalent forms of substance addiction. Despite its legal status and widespread social acceptance, alcohol contributes to liver disease, cognitive decline, cancer risk, and social dysfunction. Nicotine addiction, estimated, is another significant health concern, primarily due to its strong reinforcing properties and the severe health risks associated with tobacco use, including cardiovascular and pulmonary diseases. In parallel to substance use disorders, behavioral addictions have garnered increased attention in recent years. These are compulsive behaviors not involving the ingestion of a substance, but which activate the same brain reward systems, particularly dopamine pathways in the mesolimbic system. The most recognized behavioral addiction is gambling disorder, which is currently the only non-substance-related disorder officially classified in the DSM-5 under the same section as substance use disorders. Individuals with gambling addiction experience the same cycle of craving, loss of control, tolerance needing to gamble with more money, and withdrawal, irritability, or restlessness when attempting to stop as those with drug dependencies. Brain imaging studies have revealed that gambling stimulates similar reward and emotion processing areas of the brain as cocaine or alcohol, validating its place within the addiction framework. Other behavioral addictions, while not yet officially recognized in all diagnostic manuals, have shown compelling evidence of clinical significance. These include internet addiction, gaming disorder, compulsive shopping anomania, compulsive sexual behavior, exercise addiction, and even food addiction. Internet and gaming addiction, in particular, have become increasingly relevant in the digital age, especially among adolescents and young adults. Excessive gaming or screen time can lead to severe disruptions in social, academic, and occupational functioning. Individuals may spend hours engrossed in virtual environments, neglecting personal hygiene, sleep, relationships, and responsibilities. The World Health Organization has officially included gaming disorder in the ICD-11, indicating global recognition of its impact on mental health. Food addiction is another emerging area of concern, particularly in the context of rising obesity rates. Certain highly processed foods, especially those high in sugar, fat, and salt, may trigger reward responses similar to drugs of abuse. Research suggests that these foods can stimulate dopamine release in the nucleus accumbens, a key brain area involved in the pleasure-reward cycle. Individuals with food addiction often report loss of control over eating, cravings, continued consumption despite physical harm, and distress related to their eating behaviors. This condition overlaps with binge eating disorder but has unique neurochemical and behavioral features that justify its consideration as a distinct addiction subtype. Exercise addiction, while often masked as healthy behavior, can also cross into pathological territory. It typically begins with positive intentions, improving fitness, losing weight, or managing stress, but can evolve into a compulsive activity that dominates the individual's life. Those affected may exercise excessively even when injured or ill, feel guilt or anxiety when unable to exercise, and experience withdrawal symptoms such as restlessness and depression during periods of inactivity. This form of behavioral addiction is particularly prevalent among athletes and individuals with underlying body image concerns or eating disorders. Sexual addiction or compulsive sexual behavior disorder involves persistent and escalating patterns of sexual activities performed to reduce anxiety, seek pleasure, or escape emotional distress. Like substance users, those with sexual addiction report a preoccupation with the behavior, repeated failed attempts to reduce or control it, and continued engagement despite adverse consequences, including relationship breakdowns and legal issues. Though not yet universally recognized in all classification systems, ongoing research supports its neurological and psychological parallels with other forms of addiction. Each type of addiction, whether related to substances or behaviors, presents with its own set of challenges. Substance addictions often come with medical complications due to toxic effects on organs and the potential for overdose. Behavioral addictions may not have immediate physical effects, but can be equally devastating in terms of emotional, social, and psychological consequences. Despite these differences, what unites them is the underlying loss of control, compulsive engagement, and the continued participation in the activity despite clear evidence of harm. An often overlooked but essential point is the presence of cross-addiction or polysubstance dependence. Individuals with one form of addiction are at higher risk of developing another. For example, a person recovering from alcohol dependence may become compulsively involved in gambling or develop a dependency on prescription medications. This shift often reflects an underlying vulnerability in the brain's reward and self-regulation systems, further emphasizing the need for holistic and individualized treatment approaches. Understanding the types of addiction also has implications for public health policy, prevention strategies, and clinical training. It allows for more inclusive diagnostic criteria, the development of targeted therapies, and the implementation of early intervention programs. It also helps in reducing stigma, as many behavioral addictions do not carry the same social taboo as substance addictions, but are equally impairing and deserving of treatment. In sum, addiction is a multidimensional disorder that encompasses both substance-related and behavior-related conditions. The classification into substance and behavioral addictions helps clinicians better understand the clinical picture, design effective interventions, and provide appropriate support. Despite differences in external presentation, all types of addiction share core features of compulsion, craving, diminished control, and continued involvement despite negative outcomes. As clinicians, it is our duty to approach each form with the same degree of seriousness, evidence-based care, and empathy to ensure optimal patient outcomes and long-term recovery. Addiction is fundamentally a disorder of the brain, and its understanding from a neurobiological perspective has advanced significantly in recent decades. What was once perceived primarily as a moral failing or lack of self-discipline is now firmly recognized as a chronic brain disease, involving specific and measurable changes in neural circuits. These changes affect how individuals process reward, manage impulse control, regulate emotions, and make decisions. Central to this condition is the dysregulation of the brain's reward system, primarily involving the neurotransmitter dopamine, which plays a pivotal role in the development and maintenance of addictive behaviors. The brain's reward system, particularly the mesolimbic dopamine pathway, is at the core of addiction. This system includes a network of structures, notably the ventral tegmental area VTA, nucleus accumbens NAC, amygdala, hippocampus, and the prefrontal cortex. When a person engages in rewarding activities, such as eating, social bonding, or engaging in sexual activity, the brain naturally releases dopamine. This neurochemical response reinforces the behavior by creating a pleasurable feeling, thereby motivating the individual to repeat it. In addiction, this reward system is hijacked. Substances like cocaine, opioids, nicotine, and alcohol, as well as behaviors like gambling or excessive gaming, cause an intense and unnatural surge in dopamine far beyond what natural rewards produce. This unnatural stimulation causes the brain to associate the substance or behavior with an exaggerated sense of pleasure and importance. Over time, with repeated exposure, the brain undergoes neuroadaptive changes. Dopamine receptors in the nucleus accumbens begin to downregulate, meaning they become less sensitive or reduce in number. This results in a condition known as tolerance, where the individual requires more of the substance or activity to achieve the same level of euphoria. At the same time, natural rewards, such as social interaction, food, or hobbies, no longer bring satisfaction or pleasure, a phenomenon known as anhedonia. This change reinforces a cycle where the addicted individual increasingly relies on the addictive substance or behavior just to feel normal or to escape emotional discomfort, rather than for pleasure. Another critical area impacted by addiction is the prefrontal cortex, responsible for executive functions such as decision making, impulse control, judgment, and planning. In addicted individuals, this area shows decreased activity and connectivity, particularly during states of craving or when exposed to drug-related cues. As a result, the ability to resist urges, consider long-term consequences, or make rational choices is significantly compromised. This impairment explains why individuals continue engaging in addictive behaviors, despite clear awareness of the harm they are causing to themselves and others. The loss of control is not simply a matter of weak willpower. It is rooted in measurable changes